Thank you all for coming this evening. My name is Nima Hussain and I'll be chairing this meeting. We are clearly meeting at a time when the overall situation is grim internationally and in this country. One strange feature of the current global situation is that the upsurge in cases is overwhelmingly driven by just a fraction of the world's population in the richest countries in the world. This country, the US and Canada, and most of the countries of the EU. This is despite the fact that these countries have much higher income and wealth, which means that in general, they have better diets, longer life expectancy, and better medical care. Their governments have also been hoarding vaccines and not allowing them to be produced in the rest of the world. So then the only plausible explanation is that it's not objective factors which are driving the upsurge in the pandemic. It is subjective ones. This is a failure of policy amounting to a decision to let the virus circulate freely and cause carnage. So these are some of the issues we want to discuss this evening, and we have an excellent series of panel speakers to help us do just that. So what is the current situation? What are the consequences of that? And what can be done to fight for change? But before we begin with our first speaker, I would just like to add that all of you will be receiving in the next few days a new newsletter we are launching. It's called ZeroCovid Arguments for Activists. We hope that it will do what it says on the tin. We have literally thousands of people who've signed up to our meetings over the last year. We have a whole series of media partners who rebroadcast these meetings and other material. We want to hear from them and their campaigning around this issue, as well as campaign groups, trade unions, and others that are actively involved. We will provide updates and information for all of them, but we want it to be your newsletter, one that you can use to build support for what you do and where you can feel confident in arguing for better policies, and one you will want to share with friends, colleagues, and workmates. Now, over to our first speaker, Diane Abbott MP. Diane needs no introduction, and she will speak to us about the overall situation and some key developments. Thank you, Diane.
Thank you, Nemo. People always say I need no introduction. Actually, I'm Diane Abbott MP, and I'm the Member of Parliament for Hackney North and Stoke Newington. Again, I want to thank you all for coming, and I want to focus on the politics of this crisis and the complete failure of this government led by Boris Johnson to do what is necessary. All the reports suggest that we have a Prime Minister in name only. Boris went to the Cabinet with proposals that were designed to restrict the virus, but in the end, he couldn't put them for fear of rebellion. There was a vote last year when the measures that Boris wanted needed Labour votes to get them passed. So we have a PM in name only and a Tory government in name only. Most of you have noted that 3 of the 4 devolved administrations, Scotland, Wales, Northern Ireland, all took action after a sage briefing last year, but the Westminster government did nothing. Now, predictably, there's been a huge surge in cases. The NHS is on its knees. Deaths are rising once more. Yet this government is on a path to provide even greater freedom for the virus. That's the only way to interpret removing requirements for tests before traveling, for abandoning PCR tests, for softening it up to for the proposal to abolish free lateral flow tests, or reducing isolation to just 5 days. Don't be fooled by the PR stunts. 7,000 ventilators in schools is a drop in the ocean. The same is true of so-called priority testing for essential workers. The government says it will prioritise 100,000 essential workers, but there are almost 7 times that number of trained people working in the NHS alone, and millions more working in transport, food processing, energy, the emergency services. So all of these actions, proposed actions, are just PR stunts. The real content of government policy is no more restrictions, survival of the fittest. Boris Johnson says, we just have to ride out this virus. But you know what? Learning to live with the virus is actually learning to die with it. And we have already seen far too much dying already. The Economist magazine now estimates that just under 19 million people have died from COVID worldwide. This is the equivalent to the death toll in a major war. World War I's death toll is estimated around 20 million. Yet, tragically for the people of this country, our sophisticated healthcare system has been decimated by a decade of austerity. In this country, the NHS was completely unprepared for a pandemic that had long been forecast. They have huge staff shortages, plus high turnover because of the terrible conditions and pay, as well as a lack of even the basic in terms of PPE. And never forget, it was not just the Tory party as a whole, including Jeremy Hunt, as well as the Lib Dems, who decimated the NHS from 2010 onwards. In fact, as well as allowing huge numbers of people to die, this Tory government has pursued a reactionary agenda throughout. The Tories have always opposed the NHS and have set about privatising it. New laws will create an immigration and deportation regime that Enoch Powell will be proud of, fire and rehire, and the rise of the poor working conditions and job insecurity has created a workplace regime that Keith Joseph would have been proud of. The cloak of the pandemic is being used to undermine basic rights such as the right to vote, the right to assembly. It's vital that this is more widely understood. The Tory wish list on reactionary social, political and economic policy has always been there, but the pandemic and pandemic rage is making it all possible. The policy on the pandemic is not a sideshow, as some people to think. It is the main event. The chaos caused and the uncertainty created are the perfect cover to pursue a wider Tory agenda. Because who is hardest hit as the government establishes full freedom for the virus? As the government statisticians at the Office for National Statistics have recently made clear, it is working people, especially in the NHS, teaching, poorer people, disabled people, and women who are bearing the brunt of the pandemic. We also know from previous ONS reports that Black and Asian and minority people are hugely disproportionately hit. So these are the people we must defend, workers and the most disadvantaged and oppressed who are bearing the brunt of this pandemic. The Tories will never stand up for them, so we must. Thank you very, very much for listening to my speech.
Thank you, Diane. Our next speaker is Vicky Blake, who is president of the UCU, the Union of University and College Lecturers. Without much mainstream coverage, lecturers in different parts of the country have been involved in a series of disputes over pay and conditions, unsafe conditions in the workplace, etc. A recent ONS survey showed that teachers and lecturers in the classroom were among those most badly hit by long COVID. The virus is affecting students and lecturers, harming education and the ability to teach, and harming the health of the staff. So we're delighted to welcome Vicky back, and she can give us an update on these issues and the campaigns. Welcome, Vicky.
Thank you very much, Nemo, and thank you for also recognising the impact that long COVID is having on our members as well as COVID itself. I'm speaking to you this evening knowing that we are about to publish further updated guidance to our members, which I believe will be coming out in the next couple of days. We last updated our guidance before Christmas, and we've been really trying to stay on top of that in ways that I'm afraid we don't see echoed by our UK government. One of the first things that I want to say, and I want to kind of preface everything else that I talk about in this, is the UCU knows and understands that there has been serious disruption to education across all the sectors that we represent staff, and that is in further education, in prison education, in adult and community education, and higher education. So we're across all of those post-16 education sectors. But the disruption that has happened in those education settings has been primarily caused by and exacerbated by government inaction and insufficient action, and the same from employers. Their failures to act quickly and decisively at almost every stage, and in many cases, their unwillingness to listen properly to experts and to staff on the ground who were warning of how things were going, and who were being ignored. The canaries in the coal mine doesn't really work as a phrase because they were being ignored on the ground. We know, and we've known for some time really, if you've been following the science, but we know now, and it has been recognised, that COVID is airborne, and we now have a new variant which is extremely transmissible, but also very unlikely to be the last new variant. And we have seen, I think, our employers following the government in kind of almost wishful thinking that we are at the end of the pandemic and everything can go back to normal, when things really are very far from normal, when you have queues of ambulances outside hospitals for hours and people waiting a very long time to get help in those situations. So we again are calling on employers across all the sectors we represent. So again, further education, adult and community education, prison education, and higher education, to review and update their risk assessments in proper and meaningful consultation with our reps, because many of them have not fully updated their risk assessments from, the earlier days of the pandemic, and they're not including measures that properly recognise the airborne nature of this virus and various other risk factors, including the increased transmissibility of the Omicron variant. So we have absolutely unprecedented, and that word gets overused, we have unprecedented numbers of COVID-19 infections due to this Omicron variant. We were already in trouble owing to the Delta wave. And I just want to take a moment to note the exhaustion, the workload overload, and the ongoing health difficulties caused by the mishandling of previous waves, which we are dealing with as we are, riding the crest of this wave. It's not the case that we're tired from one round of this. After nearly 2 years, people are really wiped out. And I get a lot of messages from members who have had COVID, not just once, maybe twice, maybe 3 times. They're suffering from long COVID as well in many cases. I'm really struggling. And I myself have been diagnosed with long COVID. Touch wood, I seem to be emerging after nearly 2 years from that a little bit, but I still struggle very much with brain fog, with word loss, and my lungs aren't back to where they were. I know I'm lucky because I am not as badly affected as many of our members who are still trying to battle on with impossible workloads in classrooms and in functions that support learning and teaching in our post-16 education sector. And it's really, really important that we remember that while the link between infections and hospitalisation is weakened, it hasn't gone away. And in fact, there is now more of a crisis on wards this time. And that by demanding that our employers take action to protect students and staff in our education settings, that is also a demand that they take up their social responsibility to protect the NHS and communities for everyone. It's really also important to note that the absences that are projected to be happening across all sectors of around 25% or more, and more in some sectors than others which are higher risk. this is due to sickness, but also due to testing delays, are exacerbating pressures on our members in the workplace and also exacerbating the pressures on the NHS, where they have problems having staff to actually look after people. And so we have to remember that it's all very connected, and that every action that is taken in our sector and every other sector to protect human beings will protect everybody else too. It's about remembering that community and social responsibility. So we're in January, education settings are opening up. We know there is likely to be further increase in transmission. Anecdotally, we're already hearing about that in places where teaching has restarted in person. And the UK government has again fallen short. I haven't really laid bare how short it has fallen in the way that it's endangering lives unnecessarily through both the direct and indirect effects of COVID. And I think we're also seeing here a continuation of culture wars with the undermining of experts and expertise and the denigration of them, including by politicians, not forgetting that many of our members are actually actively engaged in research that is directly relevant to the COVID pandemic, and yet are working in institutions that aren't necessarily following the highest level needed of risk assessments in place in those workplaces. So we as a union are really clear that employers need to go beyond the irresponsible government guidance. And we said that from the beginning. They need to take decisive and evidence-based action wherever and whenever required, so that they are actively preventing outbreaks that are unnecessary and avoidable. And crucially, this will protect all of our communities, as I keep saying. It's really important to note that that will do the most to avoid further disruption to education as well. It will prevent the negative impact on the health, both through COVID and long COVID, of staff and students. But by planning properly and by taking decisive action, we can avoid all of the chopping and changing and confusing difficulties that we've seen over the past 2 years. And we will also see, I hope, if employers listen to us, an end to the unnecessary exposure of people who then put others around them at risk. And I think that our position is pretty straightforward. We're often construed as being a bit, off the wall and a bit intense about all of this. And actually, I think what we're doing is recognizing the reality of COVID. Our position is that we expect, because it's the right thing to do, our employers across post-16 education to consult UCU reps regularly and meaningfully, and to do all they can through proper risk assessment measures and mitigations to prevent transmission, protect students, protect staff, and protect our communities. And I do feel like a broken record saying this, but it remains as important as ever that this is what we expect, and this is the standard that we will hold them to. If you've been following UCU, you may be aware that we have had disputes with employers, including fairly recently the one that we had with Novus, the prison employers, and we did win that dispute, but we should never have had to go into dispute. We should never have had to have members taking action to get basic health and safety measures in place. So the kinds of things that we're calling for, in addition to calling on the government for proper funding, is a reduction of people required on site while rates are high, measures to reduce mixing and close contacts indoors. We understand there are some circumstances where there will need to be indoor activity, but we don't think that absolutely everything needs to be done at the expense of people's health. And also remembering that if you insist on having everything face-to-face indoors, you are actively excluding people who are clinically vulnerable from going into those settings, and you are causing a very difficult decision for people who are in a relationship with or caring for, or who have other close contact with people who are clinically vulnerable. And that is just inhumane, in my opinion. And I get so many messages from people who are at their wits' end because they feel like they are being made to choose between their work and their loved ones, and that just has to stop. If you got as many messages as me about this, it's just absolutely unbelievable. And often these are things that happen, situations that arise where people fall down between the gaps where guidance isn't either clear, or it is clear, but it's not being backed up enough by those employers. So that really needs to change. And that's why we need that regular monitoring done in conjunction with the unions. And we need to ensure that nobody who is at increased risk is required to work in person, and that proper alternatives are offered so that they're not given any sort of detrimental effects on their working life and their career, and they're not having to make that choice between career or their student career if it's a student, and the risks to their health. We're calling for proper safety thresholds for ventilation, so for 12 to 17 litres per second per person, which should be equivalent to about carbon dioxide of approximately 800 parts per million cubed. We are saying that employers should consider using HEPA filtration units to clean air where appropriate, and to ensure that all workers in person, and this is an important one, have access to high quality, well-fitting face masks which offer effective levels of respiratory protection from airborne transmission. So that's FFP2 or FFP3. To ensure also minimum social distancing of 2 meters to prevent close contact transmission, to keep up effective cleaning and hygiene measures, and to ensure that there is proper access in work time to regular and free testing, that's PCR and LFTs, to provide support to those who are asked to self-isolate or who need themselves to provide care to the people who are self-isolating. And as we hear of plans to start charging for testing, I mean, I don't think that there should be charging for testing, but if that happens, it will become even more important that employers in settings such as education settings, where there is a lot of mixing that happens, that they are taking responsibility and making sure that workers and students have access to free testing. They also need to be ensuring that all staff have access to vaccination and boosters in work time with no loss of pay, and to ensure that anyone who is isolating or has caring responsibilities for those isolating does not suffer any detriment to their pay or their conditions. And I think here it's really important as well that we note there is a much bigger problem with sick pay than many people have realised, because we have got people who feel that they cannot afford to be sick. And when we don't have proper sick pay provision across the board, we risk more people continuing to work and having to feel that they have to avoid testing because they're unwell, and they will spread this virus and it will intensify. And that's not a position anyone should be in. And we also just want to repeat really that on top of all of this, there needs to be proper and adequate instruction for people so they all understand what is required of them to keep themselves safe, not only working in person, whether that's on campus or out in the community, but also how to look after themselves if they're working from home, so people don't feel forgotten if they are in a position where they're working from home. And above all, what we want is for our sector to avoid a repeat of the absolute chaos that we've seen over the past 2 years, with students being scapegoated and left isolated in halls, and in some cases practically locked into their halls. We do not want to see staff blamed for the problems of COVID. And I think it's maybe a good way for me to end by saying, yes, we are in dispute with our employers over pensions and over pay and over working conditions. And we have been criticised for taking action over those things during a pandemic. Well, we called off our strike that we were on in 2019-20 when the pandemic began, and we pulled out every stop and used every scrap of energy that we had to look after our students, to support every functioning of every education institution that we work in. And we were rewarded for that with a continued degradation of our pay and conditions and an intensifying workload, being worsened now by the sickness absence problem that we've got from COVID continuing at these high levels and the transmission in education settings driving that. We have not seen employers take responsibility properly for COVID measures across the board. Some places are better than others, but we have not seen anywhere, I believe, that's been truly exemplary. And we have not seen them address the serious issues that we have with falling value of pay, equivalent to a pay cut over the last 12 years, masses of insecure work rather than secure work, which causes those problems I've just spoken about with sick pay and isolation, and workload like you wouldn't believe. It was already a really huge problem before this pandemic. We had a lot of our members really on the edge and beyond the edge. We are now beyond that breaking point. And if we don't see proper action over COVID mitigations, it will crumble. And that's not what we want to see. We want to be in our jobs. We want to be doing it properly. We want to be supporting all our students. So I will end there. And thanks very much for your time.
Thank you very much, Vicky. Sorry, the bell's gone, so it's a little loud in here. But our next speaker is Kat Hobbs from We Own It, which campaigns on public ownership. Kat can speak to us about how the government has diverted public funds to use on private sector contracts, and about how rumours of scrapping free universal COVID tests underline the desire to defend and extend private sector involvement in our pandemic response. Welcome, Kat.
Thank you, Nima, and thank you everyone for organising this meeting. It's great to be part of it. And as Diane said in opening, this agenda of the government to cut and privatise our NHS is very, very clear. And I was absolutely astounded today, and I know I shouldn't have been, but I didn't see it coming, that the government is looking to potentially get rid of free lateral flow tests. I think that's just absolutely disgraceful. I'll come back to that because I think that's part of a clear bigger picture in terms of where they're taking our NHS. But I just quickly want to outline the sort of cuts and privatisation agenda as we see it. So I'm from We Own It. We campaign for public services for people, not profit in general, and we work with lots of different NHS campaigns on the NHS, amongst other things. Obviously, what we've seen in the last 10 years has been a very clear move towards giving money to the private sector while starving the NHS, which is a classic strategy to undermine the NHS and open the door to the private sector. So we've seen around £100 billion go out in contracts to the private sector over the past 10 years. And at the same time, real terms cuts to NHS funding. We've lost 22,000 beds, hospital beds. We've lost more than 100 A&Es. And we have a shortage of 90,000 NHS staff. So even before the pandemic, and I think it's really important that we keep repeating this, even before COVID happened, waiting lists were at 4.6 million people. And so our NHS went into this pandemic with one hand tied behind its back. And at every turn, what the government's done is it's handed money to the private sector instead of the NHS. So even the NHS supply chain, which was responsible for procuring and delivering PPE, that itself was privatised. It's something that's not talked about often enough, but there is a chaotic mishmash of private contractors with 11 different contracts and 4 levels of profit taking between the PPE being manufactured and arriving at a hospital or a care home. And that was a big part of why our NHS staff were not protected the way that they should have been, and our care home staff were not protected the way that they should have been. The government ignored 44 public health laboratories and employed the private sector to set up a parallel system of testing sites. It gave £37 billion to the privatised test and trace scheme, Serco and Citel and other companies, which the Public Accounts Committee says has failed to make any meaningful difference to the virus, when it could have given that money to local public health teams who are qualified to do that work. Contract after contract went out to private companies and to companies that weren't remotely qualified to deliver, to tackle COVID. And obviously we've seen that with everyone from Matt Hancock's pub landlord to Owen Paterson being paid £100,000 a year by the testing company Randox, which then won £480 million worth of contracts. The government set up a deal with the private sector to give £10 billion to private hospitals over 4 years to help with waiting lists, but they've not given NHS trusts the funding that they're asking for. And now we've seen again that the government is turning to private sector providers and pitching them as the solution while underfunding our NHS. But we know, and I would really recommend, if you haven't checked it out already, the Centre for Health and Public Interest have done a really brilliant report on what has happened with that private sector capacity that was bought. What happened in 2020 when the NHS paid out around £400 million per month for capacity in private hospitals, but around 2/3 of that capacity was completely unused. And that's really because the private sector doesn't have the staff. They rely on NHS staff. And so that capacity couldn't be made use of. And we shouldn't be turning to the private sector to tackle capacity problems. We should be investing in our NHS. That has to be the way forward. Now, when NHS campaigners accuse the government of privatising the NHS, of course they deny it. And our supporters write to Conservative MPs all the time and say, and tell them not to privatise, not to outsource our NHS. And the Conservative MPs always come back saying, our NHS will always be free at the point of use, implying it doesn't matter who's running the services behind the scenes. Well, of course, we don't agree with that. However, as long as our NHS is free at the point of use, there's nothing to worry about, they tell us. But it's not free at the point of use anymore. And this is the message we have to start banging home, because there are these reports that lateral flow tests are not going to be free anymore. They're going to be scrapped. Lateral flow tests help us to collectively tackle COVID. This is because public health is a public good, and we all need to be able to stay healthy, whether we're rich, whether we're poor. You know, in America, you have to pay for tests, but they point towards us and say, look, it could be done for free, and it can be. And the government is making a choice, if they do this, to move away from that. But lateral flow tests, tackling COVID, is part of the NHS, is part of what the NHS is providing as a universal service. And of course, it's not just lateral flow tests. In Scotland and Wales, people of all ages can get free prescriptions on the NHS. But in England, as we know, you can't. You have to pay for them until you're 60. And now the government is threatening to raise the age until which you have to keep paying for them, so that they only become free once you get to 66. If you need to get earwax removed from your ears, that used to be something you could get on the NHS. And then in 2020, Edward Argar, the health minister, who, by the way, as I'm sure many of you know, used to work for Serco, which won the test and trace contract, confirmed that removing earwax is no longer one of the services that your GP is obliged to provide. So now you have to go to somewhere like Specsavers, you have to pay £80 for it. And then in October of 2021, for the first time ever, private hip and knee operations overtook those operations being done on the NHS, because people weren't able to wait, so they were forced to pay if they could. So this is really about the different bits of our bodies, our heads, shoulders, knees, toes, our eyes and ears and mouth and nose, just like the song, and how much of our bodies will the NHS be properly funded to look after? Because lateral flow tests should be part of our NHS, prescriptions should be part of our NHS, operations from removing earwax to hip replacements should be part of our NHS. And if they're not free, if we can't access that care, it's not our NHS. So what this government is trying to do while cutting our NHS, while privatising our NHS, is to reduce our expectations about what the NHS can provide bit by bit by bit, piece by piece by piece, body part by body part, trying to push us to go private. 150,000 people have already died in this pandemic. And in honour of their memory, we cannot let this government now use the pandemic as an excuse to further privatise our NHS. We need to reinstate our NHS as a fully public service, which, by the way, is supported by 3 out of 4 people in this country. And we need to fund it properly to deliver all of the care that we need. And we need a Labour Party that is prepared to stand for this absolutely vote-winning policy. If you agree, there's 2 things that I'd like to invite you to do. We have Keep Our NHS Public are organising a rally for emergency funding on the 19th of January at 7 p.m. That's backed by a whole range of NHS campaigns. Look out for that event and join us on the 19th of January. And sign up for We Own It's email list. Right now, we're campaigning on a couple of key battlegrounds. We're campaigning against the health and social care, the health and care bill, which would open up our NHS to more privatisation. We're campaigning to stop the sell-off of the publicly owned vaccine manufacture and innovation centre, which the government is having poured public money in, trying to sell off, a classic story. And of course, we're making the case alongside many others for a truly universal, truly free at the point of use NHS, because we rely on it, we pay for it, and we should all own our NHS.
Absolutely. Thank you, Kat. That was great. I'm really delighted to be able to say that our next speaker is Professor Susan Michie. Professor Michie is Professor of Health Psychology and Head of the Health Psychology Research Group, all at University College here in London. She is also a member of Independent SAGE, She's a behavioral expert, and so can provide great insight into what people's actual response is to the virus in general and the emergence of Omicron in particular, and how the government have failed to harness popular willingness to comply with measures to restrict the virus and what still could be done. Welcome, Professor.
Hi, I sent through some slides for you to share. Did you get them?
Yep, I think we've got them there.
Spotlight my screen.
Are they up?
Yep.
Okay, brilliant, good. Great to be here, thanks very much. Okay, so main messages, we've got the three approaches: zero COVID, China and New Zealand being a couple of countries doing it very well; low COVID, Japan, South Korea, Singapore; high COVID, Europe, America, South and North. So I think it's really important that we carry on with a global perspective, that there are other alternatives to what we're doing here. And there are several studies that have shown that those countries that are driving down transmission do best in terms of health, in terms of economy, and also in terms of the overall level of restrictions. Now, these studies are pre-Omicron for anybody who wants to challenge that. But it'll be interesting to see what happens going forward. So the choice is a political one. It's not a public health one. And what I just want to share with you this evening is what Independent Sage are suggesting we should be calling for right now, given where we are in the short term. So the next slide. The main thing we want to do is challenge the government rhetoric that this is all about restrictions. So what we've done here is to put forward a COVID protection and support strategy. And what we're saying is that what is needed right now is not restrictions. So background, I think we all know about Omicron, highly transmissible. It's breaking through immunity, both natural infection and immunization, which means that herd immunity is an absolute fantasy for people. We've heard about the severe consequences. And one of the things I really want to draw attention to that Vicky already mentioned was about long COVID. Even if, as Omicron is, it's not getting into the lower respiratory tract, it looks like it may be quite a contributor to long COVID. We should not be playing Russian roulette with this multi-organ disease. We know the government won't go beyond Plan B, and they keep arguing it doesn't want to bring in restrictions or lockdown. Now, what on Independent Sage, we're accused always of being lockdowners, of doing doom-mongers, etc. We're getting better at just saying that's not what we want. Lockdown is a failure. Restrictions are a failure. We shouldn't have to get to that. So communication, protections, and support. And I think the main thing I want to say here is that what we want to do going forward, because this is here to stay, this is becoming more and more obvious, is we need to be shaping environments, physical and social environments. Anyway, communication. So this is a report that we just produced on Friday. So the next one. Okay, so providing clear and consistent information. At the moment, we've got so much mixed messaging coming out. We have from mainstream media and from politicians, this is over, this is, we're transitioning to endemic, questioning whether we need to have lateral flow tests, questioning whether we need to have vaccination for everyone. The whole narrative is this is no longer a problem. At the same time as they're also saying, be cautious, Plan B. So we have this mixed messaging, which we know undermines trust, undermines adherence. The symptoms on the government website are still the alpha symptoms, not the updated Omicron symptoms. And the crucial thing here is the airborne nature of COVID. So as a previous speaker said, we need high-grade masks and good indoor air quality. So CO2 monitors, and where ventilation isn't enough to keep it to the 800 parts per million that has been mentioned, then air filtration. These HEPA filter devices can be brought into rooms quite easily. And then also at the moment where we have this crisis, and we are in an emergency, we are in a crisis, just reduce the number of unnecessary social contacts. None of these are restrictions. Okay, so next, protection. Promoting working from home where possible. At the last briefing, Boris Johnson never mentioned working from home. They're mentioning it because SAGE has given the modelling to show that's one of the most important things, because not only are you not transmitting at the workplace, you're not transmitting on transport going in and from, or in cafes, etc., during lunchtimes. Universities and colleges should be teaching online. All of this should be at least till the end of February. We should demand carbon dioxide monitors and adequate ventilation or filtration in all school classrooms, workplaces, indoor public venues. High quality masks I've talked about, adequate tests has already been talked about, and the vaccination is not a silver bullet. We need what we're calling vaccine plus, but for vaccination we need easy accessibility, paid time off, and extend to under 12s. Up to 10% of the NHS workforce aren't vaccinated. They have up till the February 2nd to get their first vaccination if they're to get to the government deadline of keeping their posts. So really important that we absolutely try all the ways of enabling that. And it's not just about persuasion, it's about making it accessible, paid time off, and we also need to extend vaccination down to under 12s. It's very, very surprising we're not doing that. And as said before, this is a global problem. We need global production and distribution of vaccines, and the UK to support the waiver. US is doing it, the Pope is doing it, Russia, China, UK, we have to really make a big thing of this. Next. So thirdly, the support. We need to ensure that people can isolate. Our own and other people's research shows that the reason that up to 50% of people with symptoms aren't isolating is they don't have the money, they're worried about losing their job. We need to get adequate sick pay. I don't need to tell this audience about the fact that we're one of the, if not the lowest in Europe. Important to give free digital connectivity for everyone, and ensure that students and school pupils can carry on with their education if they have to be at home, and ensure good support for businesses where they have lost out because of the surging COVID cases, or lost out to the work from home. And think about grants to businesses and other venues to monitor and improve air quality. I mean, this is absolutely key. I think we've got to be really pushing that what we need is to ensure safe environments for people. It should not be down to individual responsibility. It should be down to physical and social environments. And finally, anybody who wants to know more about this, Independent Sage is every Friday at 1:30 on YouTube. You can just search for it. We have a website. We produce statements not only like this one on a regular basis, but more in-depth reports also on Twitter. And here I've just put a BMJ article here, which was published on Monday, signed by over 100 scientists, led by a few of us, called COVID-19 an urgent call for global vaccines plus action. So I probably don't have much more time, but I just want to say this is the immediate demands that we have right now. But also I think it's really important, maybe this group could have a dedicated session to what do we want for the long term. The phrase learning to live with COVID is being bandied around. Yes, we want to learn to live with it, but what does learning to live with it mean? And I think we should seize that phrase back and say exactly what learning to live with it means. So if you do have such a session, I hope to be part of it. Thank you very much.
Thank you very much, Professor Michie. Our next speaker is Richard Murphy. Richard is Professor of Accounting Practice, Sheffield University, a chartered accountant and political economist. He is widely known as a campaigner for tax justice. Richard will be able to use his accounting and economics expertise to cut through the latest government announcements on priority testing for 100,000 essential workers and on 7,000 HPE ventilators for schools. More broadly, Richard will be able to explain why the government says it is prioritizing the economy, yet this country has one of the worst levels of growth in the G7 and is now talking about another slowdown. Welcome, Richard.
Thank you. That's quite a big agenda you've just given me. So thank you very much for dumping that lot on me at 7:15 on Monday evening. Look, I'm actually doing some research literally at the moment. I'm assembling a data set on yet another view of the government's accounts, and it's always looks really grim. But actually, there's something really important to understand about our government. It's not bust. In fact, our government has the capacity to make as much money as it likes, and it could do so without even having to tax to fund what is necessary. Let's look at what it's actually gesturing on. 100,000 essential workers. Look, I've already heard Vicky talk about 100,000, and I've heard Diane talk about 100,000 essential workers. We know there are hundreds upon hundreds of thousands of essential workers. So how do you pick the 100,000 who get this test? It's ludicrous. It doesn't make any sense. And as we also all know, and I am an avid follower of Independence Age, or rather my wife is, and I quite frequently see what's going on Independence Age as a consequence. So Friday lunchtime is Independence Age watching time in this household, and we're pretty much in lockdown. I know that we are in a situation where testing isn't the way out of this. She keeps on yelling, and I think quite appropriately, and my wife is a doctor, by the way, at government ministers saying, oh, we have to test and test to get out of this. No, that's counting the symptoms. What we are looking for are ways of dealing with the problem. And this is quite critical to this. And throughout the economics, we get the same thing. We're getting gesture politics. I mean, the whole thing about 7,000 HEPA ventilators, the moment I heard that, and it was announced, I think, on Sunday morning, and I heard it on one of the programs, I think it was Sky, I went straight off and I did the calculation. How many classrooms are there in the UK? And I only looked at schools. I didn't even include universities. But it doesn't take very long to work out there's 24,000 schools, and you assume there's 14 classrooms per school, which of course is not true. Of all of them, some are very big. And my children went to one where there were only 4 classrooms. But, you know, that's the way it goes. If you live in rural Norfolk, which we were at the time, schools come pretty small. But I used that assumption and I came up with 700,000 classrooms, which it paid no consideration to further education, higher education, universities, and all the other situations where we teach, let alone nursery education, where obviously there has been a major spread of COVID, because we know that very young children are a particular focus of concern with regard to transmission. 7,000 is less than 1% of the need. And this is the characteristic we're seeing in everything the government says. They are basically identifying a problem and turning around and walking away from it. In 2011, I wrote a book called The Courageous State. And actually in that book, I defined something which was much more resonant, I think, since, which was the cowardly state. And what I identified was the neoliberal politician who saw a problem and then said, oh, but the market can solve it better than me. I will leave them to deal with it. And that is what we're getting time and time again here. Plus this narrative, we can't afford to intervene. And I believe that that is perhaps one of the most useful things I can point out, is that we can afford to intervene. We simply are refusing to challenge any of the existing prevailing assumptions that government has made about what are the priorities it has with the allocation of its resources. Let me give you a simple number. We subsidise savings by over £60 billion a year in the UK. Most of that goes to pensions. Around 55 billion of it, in fact, goes to pensions, who have pension funds, well, the vast majority of the people who have pensions are, of course, the already wealthy, because you have to have money left over unless you are working for the state, and only 5 million people at most work for the state, and not even all of them are in decent pension funds. But most of the people who have pension funds are actually already working in situations where they can make a contribution. In other words, they're already wealthy enough to have money left at the end of the month, which they can put into a pension and get tax relief on it. And we're giving those wealthy people subsidies of over £50 billion a year. We subsidise ISA accounts. Inevitably, therefore, a subsidy going to those who are already wealthy, because you're a saver, and most of the people who have ISAs, frankly, are savers, because you don't need to have an ISA unless you've got investment income of more than £1,000 a year. And I actually don't know many people who've got investment income of more than £1,000 a year. But if you haven't, you don't even need an ISA account. But those are subsidized by over 3 to 4 billion a year now. We give away £8+ billion a year to reduce capital gains tax rates. I could go on and on and on about this. The fact is that I can pay for any number of hyperventilators if you want me to. If I was sitting in number 11 now and somebody said hyperventilators are the answer, I could say, sure, how many do you need? And I've worked out the cost. It may be £1 billion, give or take. If you really wanted the most expensive hyperventilator you can buy, the Dyson version, why we need Dysons, I don't know. But if you really wanted the most expensive, you could still do them for £1 billion. And if I'm honest with you, £1 billion is small change in the sorts of numbers that I spend most of my life looking at. So we can supply and meet this demand. The same as if we do need to continue testing, and we obviously will for people who think they have COVID, then we can supply lateral flow tests. That is simply not an issue. We can afford to do it. We obviously need to change our attitude, and I could not be with Susan more on this. The fact that we actually need to talk about how we reclaim this idea of living with normal. And this is where the government is so wrong. I've written a series of blogs over the last few days. And I mean, I don't always quote Nick Cohen. I know Nick Cohen isn't always very popular, but he actually did write quite a good comment in his column in The Observer on Sunday. And he said, the Tories are baffled by the 21st century. And I have to say, that really resonated with me, because I really think they are deeply baffled by the 21st century. I thought that was quite insightful, so I nicked that bit. I did give him credit. I'm good with my citations, but I've learned some lessons by being an academic. And they are not just baffled by it, but they want to walk away from it. We had Mark Harper today in the Financial Times, and I'm sure elsewhere, saying, I want all COVID restrictions to end on January the 26th, and I want none ever enforced again, as if that's going to help hospitality. Well, I have a friend who owns a hospitality business. It's a restaurant. It's in Cambridge. And I've known this person for some time. And you know what? The thing that they really want is people to actually be able to control the transmission of COVID. They want people to arrive who've been wearing their FFP2s on the way in, or their N95s, whichever version you want. They want to have hyperventilators in there. They wouldn't mind getting 100% tax allowance for the deduction of that straight away, or even a grant. And why not? We want these businesses to be open to support employment. The cost is tiny in terms of the employment that could support. We need to support the world to get used to the fact that these aren't, and again, I'm with Susan totally on this, these aren't restrictions. Public health is what will liberate the economy to function normally. And it seems as though these idiots who claim that they understand economics don't realize that unless you have a functioning society, you do not have a functioning economy. And you can't have a functioning economy without decent public health. It's as if they would like to give up protection from measles. They think that flu isn't ever monitored or controlled, when clearly there's a significant investment in public health there, and so on. They are utterly baffled, frankly, by what we might call systems. And we live in a giant organized system called society, the economy, and health, and so on. And if that thing is not planned and organized, words which are anathema to them, but which are actually fundamental to making a market economy work, because markets are like football matches. Without a decent set of rules and the referees, they don't work. Then unless we put those rules in place, we are, and I'm going to use a technical term here, stuffed. It's as simple as that. We cannot make the economy work. Is money an issue? I've already explained, no, it isn't. I can find it. But this is the challenge that we also need to face. And we need to discuss, and I think we're actually doing quite well here at laying down new agendas. So I'm going to lay down my offer as a new agenda as well. We need to discuss what is the priority here. Because COVID is our fairly painful, unfortunate dry run for the next challenge, of course, we're going to face, which is the climate crisis. If we can't work out what priorities we have now and how we reorganize the economy to spend to meet this challenge, heaven help us when we come to the bigger one that we're going to face with climate, because there we are going to have to reorganize a lot more. But we have to therefore sit down and ask the difficult question, and that difficult question in economic terms is what matters, and we have to allocate our resources to those things that do matter. And subsidizing savings are not the priority. Last year, I sat next to an actuary at a very large pension fund. Some of you might even have your compulsory contributions made through the government scheme managed by this fund. They said, I'd love to think that most of the people who are contributing to my fund are actually going to see the benefit from it, because frankly, they're all going to be underwater by the time most of them get to the point of paying out, because I can't see how we're ever going to manage climate change. And yet we're subsidizing that, but we aren't choosing to do the things that matter. So my challenge is the economy has to be reorganized. They are simply walking away and leaving us without rules at a time when we need a desperate degree of reorganization to deliver the funding, to deliver the structure, to deliver the support, to deliver the help, to provide the jobs, to support the people to continue in business, to provide the tax revenues, to rebalance the economy. And actually, it's the only way you could ever balance the books if that was ever a rational thing to do. And let me promise you, it isn't. I say that as an accountant and an economist. Balancing the books is complete nonsense and unnecessary. But if you really wanted to, they're going the worst way about it. If they can get it wrong, they've got it wrong. And that's my contribution to this evening.
Thank you very much, Richard, and thank you for meeting that very high bar we set for you at 7 o'clock on a Monday evening. Our next couple of speakers are going to take us to the front line of the NHS. Firstly, I'm delighted to welcome back Helen O'Connor from the GMB. Helen was a nurse for many years and now organizes them in her union role. She will be able to provide us with an update on the conditions in the hospitals, the state of the NHS staff morale, and what the demands of nurses are now in terms of conditions and pay. Welcome, Helen.
Thank you very much, and thank you for inviting me to speak. There can be no doubt that the pandemic has ramped up pressure on the NHS, but it would be untrue to pretend that only the pandemic is responsible for the chaos that's now occurring. The NHS crisis has been accelerated by years of cuts and privatisation. Since 1983, the health service has been forced to adopt the principles of the free market. Services have been hived off and competitively tendered, and there has been a rise in outsourcing to the tune of billions that could have been put into patient care, and privatisation leads to less services and worse services. Prior to the pandemic, the NHS was exposed to multiple damaging restructures, all in the names of modernisation, integrating health and social care, and moving care closer to communities. But care has deteriorated, and so have pay, terms and conditions of staff. We've seen the combined results of cuts and privatisation plus the pandemic play out in deteriorating and unsafe NHS services, patients unable to get GP appointments or get into an A&E, patients dying of heart attacks while they're waiting too long for ambulances, and rising waiting lists for routine procedures. The plans that are laid out in the health and social Care Bill make it clear that this government is set to continue to cut and privatise the NHS even during a pandemic. You can guarantee that as hubs and testing centres are set up, we are going to be losing A&Es and acute services because the sustainability and transformation plans have not been stopped or halted during this pandemic. Government and their business backers are only interested in how they can use the NHS and this pandemic to make money. Some people are reluctant to believe that the government has a strategy to sell off the NHS because local plans to cut and privatise hospitals are put in motion by stealth and shrouded in mystery. The exact same strategy has been used to privatise utilities. It goes like this: cut funding, slowly kill a service, which either then provokes or exacerbates a crisis, use the media and the press to present privatisation as the only solution to resolve the chaos, bring in the private sector, drive down wages, terms and conditions, demoralise staff, make them leave, and then offer less to the public. This Tory government are pretending that pandemic pressures, winter pressures, and the ageing population is the cause of the NHS crisis, but the truth is that it's their own strategy that's accelerating the crisis. The ultimate aim is to run the health service into the ground and move us all closer to an insurance-based model. We're now hearing the call for the private sector to be used to reduce waiting lists, and once again politicians are claiming that privatisation, which is destroying the NHS, is actually a solution to this crisis. Some of us have heard it all before. We remember what happened at Hinchinbrook Hospital when a private company took over the management and made things even worse. Just today, news broke that a lucrative deal has been struck with private hospitals to reduce waiting lists. And we have to be clear, these private companies will charge extortionate sums of money to cherry pick the procedures they want to do and then dump the rest. And if complications arise, the patient will be sent back into the NHS because most private hospitals don't have the capacity to deal with life-threatening emergencies. And within the NHS itself, private cleaning companies have been cutting cleaning towards and merging job roles throughout the pandemic, which has increased the risk of cross-infection. Domestics are expected to take up multiple job roles, which mean they've less time to do cleaning duties. And cleaning companies have been reducing cleaning hours and laying off staff all throughout the pandemic, just as we're supposed to have enhanced cleaning in hospitals. And the outsourced workers, many of them GMB members, can't even rely on getting paid on time. They're getting sick with COVID. They're now only getting statutory sick pay again, which means they're forced to come into the hospitals when they have COVID, and this is leading to its spread. And so many of these workers haven't even had a pay rise since the start of the pandemic, even though inflation is now running at 7% and above. And the clinical staff have also suffered horribly during the pandemic. They're still being failed on health and safety. Many of them are getting very sick from coronavirus. And on top of this, they've been betrayed on pay as well. And to add insult to injury, the Health and Social Care Bill is devoid of a workforce strategy to support the retention of experienced NHS staff. The bill will lead to the deregulation of professions, job roles will be merged and training driven down, leading to further dangerous deterioration in standards of care and further demoralisation among staff who will then leave the NHS. The draconian plans for mandatory vaccination are set to drive even more staff out of the NHS at a time when we need them most. GMB Union supports the vaccination scheme, but we remain opposed to mandatory vaccination because we believe cancelling and education is a preferable approach to increasing vaccination uptake. And let's be clear, mandatory vaccination has been introduced by this government to divide and rule, to break down trade union solidarity by having staff at war with each other over the question of vaccination, and this will drive staff out of the NHS. The demands of our GMB members are always around pay terms and conditions. At the moment, staff are being constantly moved around wards to plug gaps in staffing left by sickness and growing vacancy levels. This is unsettling for them and unsafe for patients, as staff are expected to take on work they're not familiar with. Non-emergency transport workers are telling us that ambulances are not being cleaned properly. But in spite of all this, we have noticed in GMB that there's been an upswing in new NHS joiners and new activists coming into our unions since the start of the pandemic. This is happening across all of the trade unions, even though no health union managed to get over the strike ballot thresholds on pay. But the potential for local trade union disputes is growing due to the accelerated accelerating NHS crisis. So to sum up, it's extremely important that all NHS campaigners unite together with the trade unions. We must build a broad coalition, of course we do, and force links with each other. But the core of our campaigning must be an uncompromising opposition to the cuts and privatisation that is still destroying the NHS. There is no middle ground in these questions, which are always inherently political in nature, and sharp divisions will emerge between those that support privatisation of the NHS and are comfortable with insurance-based healthcare coming into this country, and those that genuinely want to fight for free healthcare for absolutely everybody in this country. There is no such thing as good privatisation. Privatisation will not save the NHS from the impact of this pandemic. Never forget, pandemic or no pandemic, privatisation is the organised, legalised theft of our public assets. So let's remember that the interests of staff delivering free healthcare must be at the centre of defending the NHS. There is no exit route out of this pandemic without the NHS and its staff. And without the working class and our trade unions, there will be no robust and effective opposition to the wrongdoing of this Tory government. Thank you, in solidarity.
Thank you so much, Helen. Absolutely agree with everything that you've said there. Our next speaker has not actually spoken before at one of our meetings, so I'm sure he will receive a warm online welcome. He is Jonathan Fluxman, a former GP and member of the Socialist Health Association. Dr. Fluxman can tell us how COVID is impacting GP services around the country, whether or how services are being rationed, and the medium-term prognosis for GP care in light of government policy. Welcome, Dr. Fluxman.
Thank you very much, Nima, and thanks very much for the invitation to this great meeting. It's a pleasure and a privilege to share the platform with the other speakers. I'm actually not going to talk about what you've said, Nima. I think there's been a little bit of a misunderstanding. I'm here actually representing Doctors in Unite, which is a group of doctors in Unite the Union. And we've been doing a lot of work about airborne transmission. And we feel it's really important that we share this message and also talk about how effective airborne mitigations actually are, because the government has successfully, I think, said to all of us, it's inevitable we're going to get COVID. There's not much we can do about it. And you just have to sit back and wait to get infected and get herd immunity. Well, that's wrong. And we think it's a fundamentally wrong approach. So I'd just like to show you guys some slides. So just bear with me while I share the screen. Is that okay? Can you see that all right?
Yes, yep, we can see that.
Great, okay. So the first point to make is COVID is airborne, and there's been so much misinformation about this from a variety of sources. And still we are confronted with this problem by infection prevention and control people telling us it's droplet spread. And actually the transmission of COVID-19 is a highly political issue. If you say it's droplet, you can blame individuals and you can blame workers for getting infected. If you say it's airborne, the responsibility lies with industry, business, and government to take mitigations. This is a great quote from Dr. Richard Corsi, who's Dean of Engineering in University of California, basically saying it's been airborne from day one, it's always been airborne, it's always going to be airborne, and the job is to reduce the amount of aerosol that we inhale, period, in that inimicable American style of speaking. And airborne mitigations work, and they work against all variants. Now, it's taken a while, but the government now actually agrees. It says airborne transmission is a very significant way that the virus circulates. But whenever a government spokesperson appears in the media, and the media itself, I would add, journalists, whenever they talk about the COVID crisis, they always revert to vaccination. There's a crisis, a big crisis. What do you got to do? Get vaccinated. Of course we have to get vaccinated. It's very, very important. But it's always left there and no other mitigations are discussed. We know now that if we rely only on vaccination, we will fail in our battle against the virus. Omicron has shown that There is no such thing as sterilizing immunity. We haven't got that yet from a vaccine. Whether we will or not is an open question. But here and now, it's not enough. And what we are doing by allowing unmitigated spread is to generate, or to certainly have the potential to generate further mutants and variants which are going to evade the existing vaccines, and round we're going to go, while tens of thousands, hundreds of thousands of people get infected, tens of thousands die, and our schools get overwhelmed, our workplaces get overwhelmed with infections, and the cost to society is enormous. And I think, as some of the other speakers have said, the cost, and Diane in particular, the cost is not fairly borne. It's not equally borne. It's Black and Asian people, it's poor people who are bearing the brunt of this pandemic. And it's critical that we sort out a proper strategy. So while we continue to make demands of government, there's actually quite a lot we can do ourselves, some as individuals, but as organizations, and especially organizations like trade unions, there's quite a lot we can do. So just a quick refresher, this is Professor Lindsay Maher's famous by now graphic, airborne transmission, 2 routes, near field, okay, close to somebody, and far field. Ventilation will fix this one, far field, but only a decent face mask will stop you getting infected when you're close to somebody. Even in a well-ventilated space, if you're in each other's faces and you haven't got masks, you're going to get infected, especially with Omicron. Type and fit of masks are very important. Mask fit is getting some attention at last, although you don't need fit testing. And again, infection control is muddying the water, saying, oh, if you wear FFP2s and 3s, you have to get fit tested. You do not, unless you work in a very high-risk environment. And there's a very good paper, which I'll show you in a minute, by Professor Lisa Brosseau, proving that. And here are some studies about how effective masks are. I won't go through the detail, there's no time. But there are dozens and dozens of these studies showing how effective they are. And it's amazing how effective masks are. If we look at the numbers, this is a graphic from one study. For example, 2 people, the infected person and the susceptible person, wearing an adjusted, not a fit tested FFP2, versus 2 people wearing a surgical mask, also adjusted, the difference in infection risk is 75 times less. So get FFP2 masks, people. Surgical masks are not good enough. If you must wear a surgical mask, there's a way of knotting the ties and folding the mask to improve the filtration, or the seal rather. The material itself is not a bad filter, but it's the gaps on the sides that are the problem. Okay. Step 2, carbon dioxide monitors. What are they? You know, there's a lot of talk about using them, but practically what are they? They cost 100 or 200 pounds each. They measure CO2 from your expired breath. Make sure there's no other CO2 in the environment. So nothing burning like gas fires, cookers, people smoking, etc. The 800 ppm limit has been mentioned a couple of times already. Unfortunately, yet again, official guidance is letting schools and workplaces down. They talk about 1500 ppm, whereas SAGE minutes talk about areas of over 1500 needing to be prioritized. Not 1500 is the threshold. So this is what the CO2 monitor looks like. This is the Aranet 4. I've got one of these, and this is a reading of me on the train going down to Bristol a couple of months ago. And you can see the crowded carriage, and the safe level's 800, and at times the level was up to 2,300. Fortunately, I didn't get COVID on that journey. I think pure luck, and it was before Omicron. Air filters, again, highly, highly effective. They work by removing the aerosols which bear the virus from the air. A study quoted by the CDC, a 65% reduction in aerosols using 2 filters in a typical office space, 90% with filters and and masks, in fact, 3-ply cloth masks, not even N95s or FFP2s. There are important considerations for air filters, how well they perform, where you put the device, the noise level, etc. There's a great resource database having been put together by a chap called Stefan Stojanovic, and the link is here. All kinds of background information about them. All things airborne, go to the Clean Air Crew. There's a link there as well. Loads of good information there too. And then the final two things, which are specialist and need specialist advice, are HVAC systems, heating, ventilation, and air conditioning, and UV light systems. UV light systems will sterilize the air. HVAC, this is a typical desktop unit. Oh gosh, sorry, I don't know what's happened to my computer. Sorry about that. Just bear with me. Oh dear. Let me go back one. I think you can still see that a bit. This is a typical rooftop unit, which you can adjust a couple of things, the fresh air intake as well as the filtration. But you need specialist advice to do that. But I'm sharing this information, which I've learned myself actually, because it's good to be able to know what to demand of your employer, of your place of work, of your educational institution. You know, so many times they blow smoke in our direction, smoke and mirrors. Oh, it's too complicated, it's too expensive, it's technologically so difficult, etc., etc. And then the final slide I just wanted to share with you, if I can. Oh gosh, I'm sorry about this, but it's a quote from Professor Jimenez, who's one of the, I'll stop screen sharing, this is jumping around too much, who's one of the rock stars of airborne transmission, who says basically, if it's droplet spread, you can blame individuals. If it's airborne spread, then it's institutions, government, and business. So thank you very much for having me tonight.
Thank you very much, Jonathan. Our next speaker is the brilliant Deepti Gurdasani, who has spoken many times at previous meetings and who we're always delighted to hear from. She is an epidemiologist and statistical geneticist and senior researcher at the Queen Mary University of London. Deepti will examine the concept of mildness, which is continuously applied to Omicron, comparing to all previous strains of the virus. She will compare the outlying response of our government to that of other countries and what a vaccine plus approach would look like. Welcome, Deepti Gurdasani.
Thanks for having me. And since that's a lot to cover in 10 minutes, I'm going to start. So yeah, is Omicron mild or endemic, as many people are claiming currently? So just a brief overview of where we are. We've seen a very, very rapid exponential rise in cases to the point that, we are past testing capacity. It's very, very hard to even understand what the growth rate is currently. And it'll be hard to know when this pandemic peaks simply because we don't have the capacity to know. So just to give an example, despite all the shortages in testing, we've had 3 million cases confirmed since about middle of December. And that's equivalent to the number of cases we had in the 12 weeks before then, when we were also having mass infection, but at lower rates. As per the ONS report that came out recently, by the end of December, 1 in 15 people in England were infected. So this is not the positivity rates, 1 in 15 people coming forward for testing. This is just 1 in 15 people in the community around you having prevalent infection at a point in time in a week. And it estimated that there were 3 million infections in the last week of 2021, which tells you that, of course, the infections that we're identifying are massively being underreported. And this is the highest ever infection rate that we've ever seen in the UK. Sorry. In terms of hospitalizations, So yes, for the number of cases, the level of hospitalizations has been lower, as one would expect with the levels of vaccination we have in the population, but it's in no way had non-severe impact, because we are sort of almost at the peak of the pandemic, of the first wave of the pandemic, and about a doubling time away from the peak in the second wave in terms of hospitalizations. Thankfully, ICU admissions have remained flat. So it does look like the hospital admissions in terms of severity are potentially less severe. And about 63% of these admissions have COVID as a primary cause. So some of them, that's a majority, but some of them will be either incidental, or a large proportion of them are actually due to spread in hospital right now, which is really, really concerning. And hospitalizations with COVID in children are rather shocking right now. I mean, these are hospitalization rates in 0 to 5-year-olds, so just one age group, under 5s, with 500 admissions with COVID in a single week. Again, we don't have the breakdown here by whether COVID was a primary cause for these admissions, but it's certainly something that I would like to know more about. So the UK picture looks pretty dire. We've been seeing between 100,000, 200,000, even above 200,000 cases. At points, we've had 1,300 deaths in just the last week, and admissions have been rising steadily. And, you know, the big question is, how did we get here? So we've known about Omicron probably since the 3rd week of November, at which point many scientists sounded the alarm and said that if we didn't take action immediately, this is something that we would not only import, but would spread very rapidly within the community, given we had almost no measures in place. And it did exactly that. These are all sage minutes from 7th of December onwards, right till the end of December, all of which have essentially told government that we need to intervene early, and the earlier interventions will be more effective. If we act too late, then the effectiveness of interventions will be much lower, and early interventions will also be shorter. And plan B is not enough. Repeated sage minutes have said this, but clearly, once again, scientific advice has been ignored. I think this is the 4th time the government hasn't listened to sage advice on imposing restrictions in time. And, would we necessarily have always need a lockdown? I don't know, but the fact that we went into the Omicron wave with 50,000 cases of Delta a day pretty much gave us, well, I would say no choice, but of course the government always has a choice, and decided not to do what they needed to do to protect public health. But the pressure on the NHS was so severe before we went to Omicron that there was no resilience left in the system. And one of the things that the minister made very, very explicit was that if you act by the time hospitalizations start rising, it will be far too late, because a lot of infections from the past 2 or 3 weeks would already have been baked into hospitalizations in the future. So is it mild? The short answer is no. It does cause less severe disease. And by that, I mean, for the number of cases, the level of hospitalization is lower than Delta in an unvaccinated person. But there are 2 bits that people mean by severity. One is it's very intrinsically less severe. So if it was going to spread in a completely non-immune population, would it be less severe? The answer is probably yes, less severe than Delta by about 0 to 30%. But most of the reduced severity actually comes because of the fact that it's able to escape immunity. So the people that it's infecting are disproportionately people who are vaccinated, people who have had previous infection, and people who are boosted. So it's essentially getting through an immune wall that Delta wasn't able to, which means that these people, because they have some protection against severe disease because of their past immunity, also means that the severity is lower. But a few caveats here. So the intrinsic severity is lower, but a large part of the severity reduction is because of who it's infecting, not because this variant is necessarily by itself that much less severe. So imagine that this variant was about half as severe as Delta. But remember that Delta was between 1.5 to 2 times more severe than Alpha, and Alpha was about 1.5 times more severe than the original variant, which means Delta was about 3 times more severe than the original variant. And even if Omicron is half as severe as Delta, it's still more severe than the original variant. And I don't remember anyone describing that as mild. So it's not the flu, as many people seem to be claiming. And remember that even though it's infecting people who Delta wouldn't have infected before, so largely immune populations, it's also infecting unvaccinated people. And the risk of hospitalization in somebody is essentially the risk of them getting infected and the risk of them getting hospitalized if they get infected. So even if the risk of them getting hospitalized if infected is slightly lowered, need to remember that the risk of them getting infected is higher with Omicron, because Omicron is able to penetrate the protection of vaccines in a way that Delta wasn't. So their overall risk is still very high. And remember that vaccine protection against Omicron has dropped compared to Delta unless you're boosted. So boosting is vitally important and will reduce your risk. But without boosting, your overall risk is higher, potentially even higher than Delta, because your chance of getting infected is higher. So what does Omicron mean for vaccine efficacy? I think this may have been covered already, but essentially it means a huge decline in efficacy against prevention of infection, particularly, with 2 doses of AstraZeneca, but also with Pfizer and Moderna. And you can see the massive reduction compared to Delta here, which will of course have consequences for transmission at population level. Thankfully, the protection against severe disease is higher, but it's not as high as the protection we had with Delta. And even with boosting, the protection increases to about 88%. That is also much lower than the protection we had with Delta with boosting, which was very near 100%. But of course, that protection also wanes with time, which is the worrying bit here. So the protection, even with boosting, is not permanent. And as you've all probably heard, Israel is giving 4th boosters at this point in time. What's the impact by age? So the major spread of Omicron has been in sort of the 20 to 40 age group, but because of essentially infection rates being very, very high in school-age children, when schools closed in December, essentially children have gone back to school with very, very high infection rates. So that's 1 in 12 children primary school age and 1 in 17 secondary school age children infected as they go back to school. And this is the worrying bit. We're seeing rises in the 50 plus or the 60 plus age group as well, which is the population most at risk from severe disease. Even though they have protection with boosters, that protection is not 100%, which means some of them will sadly, get admitted and die. Now, what Omicron means for long COVID, I don't know, but this is just showing the impact of even Delta up to November. The long COVID rates in children have tripled in the last 4 to 5 months. I mean, this is shocking, and I don't know why it's not in the news, but 117,000 children now have long COVID. And this is until November. So the impact of Omicron on this and the impact of December very high case rates in children hasn't even been felt yet. And I'm really, really worried about what this will do for long COVID. So where do we go from here? All this shows us that this virus can make huge evolutionary jumps in different directions. It doesn't necessarily mean that it's evolving to become benign. It clearly has a huge evolutionary space and can evolve in any direction. Endemicity is unlikely, I think, even in the longer term. I think what we will see with this will be massive surges 2 or 3 times a year, which will be hugely disruptive to healthcare and to society and public health and cause a lot of deaths, even with vaccination. And vaccine protection, while vitally important, does wane with time. It's not variant proof. So every new variant that comes along erodes it that little bit more. And booster protection also wanes with time and is also not variant proof. So we need a globally coordinated suppression strategy. One, we need to slow down variant evolution, and we need to use variant proof measures. I mean, those are the ones that Dr. Fluxman was talking about. Airborne spread. Whatever the virus, it's spreading through the air. If you use hybrid masks, ventilation, distancing, those measures will always together work, but it needs to be a multi-layered approach, not one over the other. And children need urgent protection here. They've been completely hung out to dry, having to go back to schools without mitigation. That's the one population that's largely still unvaccinated. And it's really, really shocking how they've been left. So living with it has often been used as a substitute for let it rip. And that has huge impacts on health, and they are inequitable. So it means largely leaving vulnerable and disabled populations to die. I mean, 60% of our deaths have been among the disabled. And so what do we need to do? We need high-grade masks in all indoor spaces, and that's FFP2 mask plus. If you have two people wearing FFP2 masks, your risk of getting infected, even if the other person is infectious, is very, very low. I mean, I would much rather be in a room with somebody with an FFP2 mask rather than somebody who's vaccinated, I mean, ideally both, but, if I had a choice. And they're the most overlooked precaution that you can use in this pandemic. High-grade PPE for healthcare workers. I mean, I'm hearing this talk of reducing the isolation period now from 7 days to 5 days, when there are studies from Japan that show that the median infectious period is actually 3 to 6 days. And given the amount of nosocomial spread we have in hospitals, which is huge in the UK, I cannot understand why healthcare workers are not given FFP3 masks, which they all should be to protect themselves and others. Ventilation. We need long-term changes in building infrastructure, but that requires the government to understand that this is not a problem that's going to end this summer or this December, like they keep predicting. They need to accept that this is a long-term problem, and building infrastructure, all of that needs to change to have ventilation. We need air cleaning strategies in workplaces and businesses, in schools. I mean, Japan is doing all of this. There are different ways of even living with it that Singapore, Japan, and many other countries have done, South Korea included, that we are not taking. Global coordination to deal with misinformation. Countries like India, South Africa, vaccine uptake is still very low, even when they've had supplies, because of misinformation. There's a huge misinformation campaign in the UK as well that we do need to deal with. And of course, basic things like support for isolation that we still haven't got, good test, trace, isolate systems, which we still haven't got. Global vaccine equity is an important part of this, but it's not just about vaccine sharing. It's about increased domestic manufacturing of vaccines through technology transfer agreements. Vaccines, need to be offered to everyone, including children, which is something that we still haven't done compared to other countries. And I want to say UK policy is very exceptional. I think I can't think of any other country except perhaps Sweden and the Netherlands who have done what we've done and essentially taken almost no steps to deal with the Omicron threat. And you can see all throughout the world, healthcare systems are being overwhelmed. I mean, we've had to call in the military. We've had 24 trusts declare incidents. We have 1 in 9 to 10 NHS staff off sick. I mean, if this isn't the NHS being overwhelmed, then I don't know what is. Sorry, I'm going to stop sharing now.
Thank you very much, Deepti. As usual, a hugely informative contribution. Our penultimate speaker is the Member of Parliament for Leeds East, Richard Bergen MP. Richard is a stalwart of our campaign and a wonderful... Go to Ben. I'm sorry, I think the bell's going for the vote, actually. I think we're going to move... We'll come back to Richard. We're going to move to Ben Chaco, editor of the Morning Star and one of the co-conveners of the ZeroCovid Coalition, along with Diane Abbott MP. Welcome, Ben.
Thanks, thanks so much. And obviously, it's very important that Richard goes to vote. So thanks for bringing me forward. It's been really interesting to listen to everybody tonight, and I do appreciate coming on after such a range of experts. We've heard so much about how far we are from getting past the pandemic, but there's a denialism, I think, on behalf of our political representatives when it comes to COVID. It goes for the Prime Minister, obviously, with the talk of riding out the wave of Omicron. The 2022 rebrand of herd immunity is essentially what he's saying. But it should be so obvious that that's not going to work. As we've heard so much now from other speakers, Omicron has made it really clear we're not going to get herd immunity. People who've been vaccinated can contract the virus. People who've had the virus can contract the virus again. It's not going to happen. Labour's attitude is better, but it's not much better. Keir Starmer talks of building back after the pandemic in 2022. The Labour Party's attitude does seem to be that this is a temporary crisis, something that's a one-off. Once we get past it, we'll go back to politics as usual. But that's very, very far from the case. Hold-ups on vaccine patent waivers, vaccine hoarding by the richest countries, mean that COVID will continue to spread and mutate for the foreseeable future. The World Health Organization estimates that Africa will not hit similar 70% vaccination levels that we are approximately there in Britain at the moment. Africa won't get there until the end of 2024. So that's, a whole 2 years away. Unfortunately, unless we see a completely different approach to handling this pandemic, we are going to keep cycling through infection peaks and troughs. And Deepti was talking about that just now. What we're going to see is just almost like a kind of Groundhog Day, where every 6 months there's another COVID peak and there's another discussion about should we be having a lockdown, another wave of preventable infections and deaths. So that underlines how important it is that we take a global approach to tackling the virus. The government has to be forced to change its stance on vaccine patents. Britain, with the European Union, Switzerland, and South Korea, is one of only a handful of opponents of a patent waiver that's supported by almost the whole world. Even the United States, which is normally the fiercest defender of medical patents in courts worldwide, is supportive of this. So aside from the moral disgrace of effectively limiting access to vaccines in the global south, we have to raise awareness in Britain that this profit-first approach in service of big pharma prevents us from protecting ourselves from the virus. Challenging the power of big pharma in for-profit medicine also seems more relevant than ever given the 3-month deal we saw announced today, in which the public will pay through the nose to private healthcare providers to make up for staffing and bed shortages, which are caused by the Tories. They're caused by the failure to prevent another wave of COVID, the failure to take measures to restrict the spread of Omicron, but they're also caused by the long-term chronic shortages of staff in the NHS that the NHS has been allowed to live with. We've seen annual reports way back before the pandemic. We had almost, talk every year of an NHS winter crisis. Nothing was done about it in terms of fixing those things. We've heard before about exercise sickness and how the government knew from its own drill that the pandemic would rapidly lead to it running out of PPE, which did happen in 2020. But equally, the government knew that the NHS was not in a condition to handle a massive pandemic because it had been so underfunded and under-resourced that it was living with massive staff shortages. So when we ask where next for the COVID crisis, we have to assess the ways in which Britain's disastrous experience of COVID has shown up deep-rooted problems in the structure of our economy and what we need to do about them. The NHS relying on the army to help out in London is an indictment of the way the Omicron wave has been allowed to get out of control, but also an indictment of those longer running problems in the NHS. If we're going to have a health service that can address the huge backlog of treatments built up and meet the challenge of this and future pandemics, we need to recruit and retain staff. And that means proper pay rises. And I'm glad we've heard from Helen O'Connor at the GMB, because NHS workers' pay demands are actually a public health issue as well. The drive to evade responsibility to public health, to downgrade our expectations of the government's responsibilities to maintain public health to the sort of days when diseases like measles or cholera raged unchecked, as we heard from Richard earlier. The days when it wasn't the state's problem if people got sick and died in large numbers. COVID is being used by the Conservative Party to accelerate that downgrading of expectations as to what we can expect from the state. Britain has already lost over 150,000 lives by the official count to COVID-19, the highest figure in Europe, proportionally among the highest in the world. We're being asked to get used to a steady backdrop of preventable deaths. The Conservatives and their media allies like The Telegraph take the line that the country needs to stop snivelling and get back to work. We've forgotten what coping with a normal, everyday illness is like, columnist Alison Pearson wrote in The Telegraph this week. But those advocates of riding out the wave essentially argue that you can't eliminate the risk of illness, or the adverse consequences of stricter public health measures outweigh the benefits. And that as the majority of those getting seriously ill are unvaccinated, tougher controls will be punishing the majority to protect an irresponsible minority. Now, these arguments are disingenuous. The cost of a refusal to contain the virus is not just paid in human lives, but increases the economic fallout. This is one reason Britain, which has the highest COVID death toll in Europe, also saw the biggest economic downturn. China, which pursued a zero-COVID strategy, is able to maintain ordinary economic and social activity in most areas most of the time, because it has an effective test, trace, isolate, and support strategy in place for whenever there's an outbreak. Now, we've seen the success of that policy in Xi'an this week, actually. They announced today that the outbreak in Xi'an is over. And yet, despite the far lower death rates in countries like China, there were 67 deaths from COVID in China in the whole of last year. Compare that to the 1,300 in a week we just heard about in this country. Despite that, we're seeing a massive attack on zero-COVID strategies being waged in the media, people saying that they are hugely restrictive of people's freedoms. That's actually the opposite of the case. If you look at the Chinese example, is there success in suppressing the virus based on lockdowns, restricting people's movement, restricting economic activity? Actually, it's the opposite. Compared to Britain, they've had very localized lockdowns, very brief lockdowns. Because they have an effective strategy for identifying where the virus is spreading and dealing with it, they're able to continue to run things as usual most of the time. So we've heard from the US president this week that we don't need to get used to a new normal in which COVID is a permanent feature of our lives. And I think he's right about that. But if we're going to avoid that new normal, it's not going to be by going back to the old normal. It's only going to be if we have a shift to a global suppression strategy. The first thing we can do towards that in this country is to push our government to drop its veto on a vaccine patent waiver. It has to mean better resourced public services as well. Proper sick pay to allow people to isolate if they need to. Financial and housing security for families, and that means pay rises across the board. So this is a health crisis, and I'm privileged to speak alongside scientists and economic experts who have been brought together by the Zero-COVID campaign to explain the science and the economics, but the solutions, I think, are social and political as well. To end the pandemic, to get beyond it, to protect ourselves and others from future pandemics, we need a radically new political approach that puts people before profit. We need a complete change of strategy in this country. So thank you for listening.
Thank you so very much, Ben. And thank you to everybody that's spoken. I think we're still waiting for Richard Bergen MP to finish voting. But just want to thank everybody who has spoken so far for all the thoughtful contributions. Before we end, I want to pass on apologies actually for Kevin Courtney from the NEU, who had to pull out of tonight's event, and he sent his sincerest apologies. The NEU have been fantastic representing their members and fighting the government back on these things that endanger teachers. I also want to remind everybody about the newsletter. So please don't forget to check your inboxes for our newsletter, the new newsletter called ZeroCovid, Arguments for Activists. And before we get Richard back on, just a question for Professor Gurdasani. Are you still on there? Hello?
Yes, I'm here, sorry.
Yeah, that's fine. Just wanted to ask, we've got some questions about vaccine apartheid and what impact has vaccine apartheid had on the global fight against COVID?
I mean, it's had a huge impact. You can just see the level of hospitalizations we're having right now. I mean, they have overwhelmed the NHS, but if you look at the number of cases we've had, I mean, for the number of cases, we still haven't hit the January peak. And a lot of that is vaccines and boosting. I mean, you saw the difference that boosting can make, and if you look at most developing countries, I mean, the vaccination rates, even in 1 or 2 doses, are so low, and boosting hasn't even started, I think, in most countries, which means that actually the impact, although it was disproportionate before, as every new variant arises, I think the impact and the gap possibly widens because, countries like Israel can afford to give 4 doses to people, and many countries, people haven't even received 2. So, but I don't think the solution is, just donating vaccines. I think, as Ben said, we need patent waivers, we need domestic manufacturing. We have to get out of the zero-sum scarcity mindset. And the scarcity exists because we don't have that manufacturing in many, many countries. Like, we had AstraZeneca manufacturing in India, which made a huge difference, and we need more of that. But we need that with mRNA vaccines as well, which are more effective and are very, very good for boosting. But that also means we need support for sort of cold chain infrastructure, and we need to deal with global anti-vax disinformation campaigns because they're hitting everywhere. I mean, Facebook, WhatsApp has a massive influence in many countries, including India. And unless we deal with that, just vaccine supply is not going to sort out the problem either.
Of course, thank you so much, Deepti. I think we've got Richard Bergen MP with us now.
Hi, sorry to mess people about. I had to
No,
go
it's
and
okay.
go and vote. And things are so old-fashioned here. You have to physically go and vote. Very strange. And so I'm sorry to have missed so many of the speakers due to voting commitments in Parliament tonight. But I want to congratulate the ZeroCovid Coalition for carrying on to make the case for dealing with this situation in the most appropriate, science-based and humane way. And so thanks for inviting me to this first important meeting of 2022. Now, our communities are being hit by two immediate crises. Firstly, a public health crisis, which is now entering its third year, of course. And secondly, a cost of living crisis hitting those who can least afford it. Now, both of these crises are deadly serious, but neither are being taken seriously by the government. So it's essential that we organise to force a change in policy on both fronts. On COVID, the immediate challenge we face is taking on the government's ride it out approach to COVID. This seems little more than the herd immunity strategy suggested at the start of the pandemic. Now, of course, some things are now different from the start of the pandemic. We've got the vaccines, thanks to huge public funding that went into them. Now, that public funding alone should mean that the vaccine companies are forced to share the technology with developing nations so that they can produce the vaccines themselves and drive up their vaccination levels. A group of vaccine experts recently released a list of over 100 companies in Africa, Asia and Latin America that could produce COVID vaccines. Yet sickeningly, Johnson's government is putting profits before lives by being one of the main governments in the world, blocking the global sharing of vaccine patents that would actually allow this to happen. So we need to be demanding that the government plays its part in ending this pandemic worldwide by backing, not blocking, the sharing of the vaccine technology. And at home, we're much more fortunate in relation to vaccines, but despite the successful vaccine rollout, the damage caused by the government's reckless strategy is tragically clear. This weekend, we hit 150,000 official COVID deaths here in Britain. Now, in preparing for tonight's meeting, I was looking at what the death toll here in Britain would have been had we followed the approach of other countries and so had their equivalent deaths per million people in this country. And the figures made me so angry. If we had same death rates as Germany, we would have saved over 55,000 lives. If we had the same death rates as Denmark, Vietnam, Finland, or Norway, we would have saved over 110,000 lives. If we'd had the same death rate as Japan, South Korea, or Australia, New Zealand, Taiwan, or China, we would have had fewer than 10,000 deaths. That means we would have saved 140,000 lives of the 150,000 lives that have been lost in this country. That's the human cost of this government's reckless approach. That's what live with it really means, doesn't it? Given our incredibly high death figures, the very first promise that we should make ourselves this year is this: we have no confidence in this government, and they should not be trusted to be doing the right thing. We should have no confidence in the new strategy that we are told the government's about to announce on finally living with COVID, as they put it. Their live with it strategy is a do nothing to reduce it strategy. Their live with it strategy is just to pretend it's not happening strategy. Their live with it strategy is a danger, not just to public health. It's a barrier to getting our lives back to normal and getting the economic recovery going. We need to win the case for an alternative, measures that are employed alongside the vaccines, and not pretending that vaccination alone can do all the heavy lifting. So what should that be? What should our alternative be? Firstly, we need to be demanding measures that reduce the caseload, not just accept that high levels of infection are now inevitable. The Labour government of Wales is putting in place sensible public measures from which I believe we can learn on more extensive mask wearing, on social distancing, on the rule of 6, etc. Beyond that, increasing sick pay to real living wage levels for all workers must be a core demand. Pathetically low levels of sick pay are again leaving millions of workers to choose between putting food on the table or self-isolating to protect their community. Over 2 million workers don't even have access to sick pay. Now, I recently organised a letter from 50 parliamentarians to the Chancellor demanding sick pay at real living wage levels. I was pleased that 50 MPs signed that letter. This is a demand of the TUC, and we should all call for it. Thirdly, we need to create the safest indoor environments possible, where it's as near to being safe inside as it is outside as possible. Experts suggest that exposure to the virus in a classroom or an office is 1,000 times higher than at a supermarket. So nothing sums up this government's woeful COVID policies better than promising just 7,000 air purifiers for schools when there are over 300,000 classrooms. We must stand with the teaching unions, fighting for every classroom to be fitted with air purifiers and back this basic right in every other workplace. Fourthly, we need a proper public education campaign, informing people about the need for proper masks, why they should be wearing at least the FFP2 masks that filter, as we've heard, at least 94% of airborne particles. We need to start the campaign for free tests to continue, because it looks like they're going to do away with that if they can get away with it. How appalling, doing away with free tests, it beggars belief. These are both basic public health measures, but they're deemed a problem for the Conservatives as they make it harder to pretend that the issue has gone away. We also need to be demanding that the capacity of our health system be expanded. Omicron has clearly decimated current staffing levels, but this NHS crisis goes way beyond the immediate pandemic pressures. It's a result of permanent and dangerous staffing shortfalls that form part of the wider Tory underinvestments, privatisations and outsourcing in the NHS over the past decade. The 93,000 NHS staff vacancies and over 100,000 social care vacancies will only be tackled through proper pay rises. And I fully back the demand from NHS staff for a 15% pay increase, which would help address the real terms pay cuts experienced over the past decade. In conclusion, undoubtedly, COVID will continue to impact our society for as long as the government fails to put in place a proper public health strategy. Another variant is worryingly likely, and we have to hope it isn't one that evades the immunity given by vaccines. COVID is not going away, and nor should we until the government puts in place measures that actually protect the public.
Absolutely. Thank you so very much, Richard, and thank you to all the brilliant speakers this evening. Just once again, please keep an eye out on your inboxes for the newsletter. Thank you again to everybody. Have a wonderful rest of your evening, rest of your week, and stay safe, everybody.